Hey, hello. Thank you both. I appreciate the call that both of you gave. And Dr. Delphin Rittman, thank you for your husband's service. So thank you both. Ms. O'Connell, let me start with you, please. Um, and this will be something we spoke about on the phone, but I still think it's worthwhile to publicly speak about. The speaking of ASPR and how they got kind of shoved to the back seat in this last response to the pandemic. My appropriations guys said, just kind of pointing things out. They don't know how to dispense billions of dollars, HHS in general and ASPR in particular. Inevitably, this is going to fall to FEMA because FEMA knows how to dispense billions of dollars. Unfortunately, FEMA doesn't have medical staff, and so it's going to be not as efficient as if they did. And that was just his musing when it started. And it turns out it was absolutely true. So it's kind of a structural problem, if you will. So how would you address that structural problem without creating a gazillion other people who are working from home during a pandemic?
Senator Cassidy, thank you so much for that question, and thank you so much for the good conversation we had. And I enjoyed speaking about this particular issue. And if I'm confirmed, it's one I've been reflecting on because we currently have, as I mentioned to Ranking Member Burr, BARDA is the partner with DOD right now in what was the Operation Warp Speed. And what DOD has brought into the department is extraordinary capacity when it comes to logistics, acquisitions, and contracting. And one of the first things I'll be faced with, if confirmed, is figuring out how much of that capacity should be brought into the department. And
Now, it does seem to be a duplication of effort because it isn't often that this is required. Let's hope never again. So we don't want people just kind of twiddling thumbs waiting for the next pandemic. You see where I'm going with that.
Absolutely. Any capacity that we add to the department would have to be right-sized and fit for purpose. Also have a peacetime use as well as a pandemic or emergency use. So I agree with you on that, but it is something that I think the department is having to face and think about. And I, appreciated your question about that.
Great. And Dr. Delphin Rittman, thank you again for calling and for speaking. And obviously, as you know, one of the criticisms is what happened at the Whiting facility, if I'm pronouncing that correctly, or Whiting facility in Connecticut when you were the director overall. And so I just thought I'd give you a chance publicly to speak to that, because if I'm asked, I can refer to your public statement.
Yeah. Thank you again, Senator, for our conversation and for that question. The patient abuse that happened at Whiting was a tragedy and should never have happened. I take patient abuse very seriously, and so immediately, working with my team, called in the state police because I wanted an outside investigation in addition to our HR investigation. Ultimately, 37 staff were separated from state service.
Can I interrupt
and
just
10
for a
staff.
second? Because it seems critical here is at what level were you relative to the facility? Do you follow what I'm saying? Mm-hmm. Because if you're the head of a whole department, but there's 4 layers between, that's one thing. But if you're like in the office at the Whiting facility, that is the other thing. So could you elaborate on that, please?
Yes, I appreciate that question. So as commissioner, I have a number of state hospitals, so 2 state hospitals that I oversee. Whiting Forensic Hospital is one of those hospitals. At the time, it was combined with Connecticut Valley Hospital, but now it's a hospital unto itself. That was part of the system change we put in place. So there's myself as commissioner. There was a CEO of the hospital. There was a medical director, a full leadership team of the hospital. And that was one hospital that I oversaw as part of the full Connecticut system of care.
Okay, and I'm sorry, and I interrupted your answer. So continue, please.
Yes. So of course, the first step was ensure the safety and security of the patients there at the hospital. Then also called in the state police, wanted an immediate outside investigation. Ultimately, again, 37 staff were separated from state service. 10 were tried and convicted related to the abuse. Worked with the state legislature around having a law set that if people fail to report abuse and neglect, that is a crime. So really worked on specific system changes related to that. Also worked on enhancing our security and camera systems throughout the hospital. Brought in a consultant and reviewed policies, procedures, and implemented other significant system changes within the hospital. This work is ongoing in terms of ensuring that staff have the appropriate training, that they're aware of the policies related to reporting. And so it has been an ongoing area of work. But ultimately, my aim is to provide quality care, to ensure the safety and security of the individuals that we serve, and to help people move into recovery.
And so if I may summarize, you were not directly responsible, but you ultimately were, but still you were above, and you had a leadership team between you and these incidences, and that subsequent to this, the corrective measures have been taken as well as the punitive for those who were concerned, correct?
That's correct, Senator, yes.
But there's many other things to speak about, but I'll defer to my colleagues on I know Chris Murphy and I have worked so closely on many of these issues too, so I'll defer to them on those other issues, but thank you both for your answers.